Parsing through health insurance plans can feel like trying to read a foreign language. And one of the biggest terms that trips people up is deductible. So today we're breaking down what deductibles are, how high and low deductible plans differ, and how to figure out which one makes sense for you. Let's get into it. So what is a deductible? A deductible is the amount you pay before your insurance starts helping with medical costs. Quick reminder, your deductible is not your premium. Your premium is basically your monthly subscription fee that keeps your plan active. Your deductible only starts applying when you actually use medical services. And paying your premium does not count towards your deductible amount. So keep that in mind. Let's look at an example. Jenny has a health insurance plan with a $240 monthly premium and a $5,000 deductible. So she will pay $240 each month. That's her total recurring charge, no matter what, rain or shine, sick or healthy. She only worries about paying that $240 premium until disaster strikes. She breaks her ankle and gets a $3,500 bill. Because she's only been paying her premium and hasn't received any other medical care this year, she hasn't hit her $5,000 deductible yet. So she'll be paying that full $3,500 out of pocket. However, later that year, she has a surgery and racks up a $10,000 hospital bill. Because her deductible is $5,000 and she's already paid that $3,500 when she broke her ankle, she'll only need to pay the remaining $1,500 of her deductible. Her insurance will cover the rest of her surgery bill. That's $8,500 she would have been on the hook for had she not had an insurance plan. The moral of the story here is that your deductible directly affects how much you'll spend throughout the year. So choosing the right plan matters. High deductible plans come with a simple trade-off. Because the deductible is so high, your monthly premiums will be low. You'll pay a small amount to keep the coverage active, but when you need care, you'll pay higher upfront medical costs. So who is this good for? 1, people who rarely visit the doctor, people who are young and healthy, people who want to save money on their monthly premiums and can handle big one-time expenses if needed, and people who have a health savings account or HSA to help pay down big bills. On the flip side, high deductible plans won't be ideal for people who have chronic conditions or anyone who expects frequent care and can't afford large surprise bills. Low deductible plans just swap the trade-off. You'll pay more each month for your premiums, but you'll pay less in upfront medical costs. These kinds of plans are great for people with ongoing medical needs, families with kids who get sick often, individuals managing chronic health conditions, or anyone who wants peace of mind and fewer unpredictable bills. With a low deductible plan, typically even if there is an emergency that requires surgery or hospitalization, the plan starts helping fast. You may only owe a small percentage of the cost once the lower deductible is met. So, which one is better? The truth is, neither plan is automatically better or worse. It all depends on your health needs, your budget, your lifestyle, and risk tolerance. Some people save tons of money by choosing a high deductible plan because they rarely need care. Others save just as much choosing a low deductible plan because they do need frequent care. If you're having trouble figuring out what's right for you, just ask yourself, do you go to the doctor a lot? Are you currently managing ongoing conditions, appointments, treatments, or medications? Do you want smaller bills up front or smaller bills when you get care? What feels more stressful? Having to pay a higher premium each month or having to pay a high deductible each year? The right plan should match your health needs and your comfort with financial risk. That's it for today, but if this helped you, give us a like and consider subscribing for more beginner-friendly insurance breakdowns. And if you have a question about insurance, throw it in the comments below and it may be the topic of our next video. Thanks for watching.